Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
If the treadmill test of the patient is positive, then what do we do? If treadmill test of the patient is normal, if the treadmill test of the patient is normal, then echocardiography is done to mainly detect the wall motion abnormalities. To detect the wall motion abnormalities like hypokinesia or dyskinesia. So whether there is any abnormalities in the movement of the wall. So for that we should do an echocardiography, and we can also do cardiac nuclear imaging can also be done, which is using either a thallium or system maybe uptake. With the help of thallium or system maybe uptake, we can do cardiac nuclear imaging.
thank you and thank you for watching.